Thank you for joining us today. The webinar will begin in a few moments.
Welcome, everybody. I'm Katy Brooks with the Bend Chamber of Commerce, and I want to welcome all of you for joining us today for the COVID Impact webinar. Welcome to week one of phase one, the reopening of Bend, and it's been an interesting process to watch everybody try and reopen their doors under the new protocols, and just want to do a shout out to all of you businesses out there who are trying to interpret those guidelines and do your best to service your customers and open your doors. And anything we can do to help, please let us know. So for today, our focus is on childcare. And obviously it wasn't a great story before COVID. Only 1 in 3 kids had a slot available in Central Oregon before we came across this fabulous virus. And now it's really also ravaged the childcare industry. And predictions are that many folks are going to have a really tough time making it through the shutdown and through the initial months coming back for a number of reasons. We want to talk about that today. We want to talk about the implications of that industry, how they're implementing those guidelines, what are the implications to families in Central Oregon, and also to employers as they try to get their employees to come back to work when there's fewer childcare slots available out there than there was before the virus hit us. So we have a full program today. Before I introduce our speakers, wanted to start off by just a few announcements. Just wanted to know that we have been taking applications for the Bend Chamber's Boost Up Bend Fund. This is in collaboration with the Oregon Community Foundation. And it recognizes a growing and specific need for all these businesses out here who are trying to reopen under the new COVID guidelines and trying to address their added expenses for sanitizer, plexiglass, resupplying, personnel, costs that are associated with reopening. We are supplying grants for small businesses and sole proprietors up to $1,500. And small businesses up to $2,500 with emphasis on minority and women owned and just sole proprietors in general. So just trying to help out the folks that haven't had as much access to some of the other funding streams that we've been seeing come out of the federal and state government. So another thing that I wanted to say about that fund is that it would be really terrific if we could get some more money. So we're trying to round up as many folks to help add to the fund as possible. Within the first, let me see my notes here, few hours, we have many applicants, and now we're up over 200 applicants for grants. And I'll tell you, we're probably maybe 1/4 of the way there financially or less in meeting all the requests that we're receiving. So thanks to VLOX Systems and the Ward Family Foundation, we have a $20,000 community match opportunity to increase the size of the fund. Every donation between now and next Tuesday will be matched up to $20,000. So we could get $40,000 more in the kitty to help our small businesses here in town reopen So I really encourage you, if you have the means or if you know someone who does, to get the word out. You can get more information on our website, www.benchamber.org. And all of the information you need is on that website, whether you want to apply or whether you want to donate. And along those lines, there are other local resources available. I know as many of you are trying to reopen, it's really hard to find supplies. So we, along with many of our partners, including the Emergency Ops Center for the Deschutes County, have started a list of where local supplies are. And that's on the centraloregonsos.com website. It's a website the Bend Chamber has been keeping up since all this came down. There's lots of resources on there, including where you can find supplies as you reopen. One of the vendors that you'll see there is Valor. They are a new partner for the Chamber and have a new product called Crush Anti-Microbial, EPA certified as a disinfectant that is eco-friendly. So that's a new addition there, and we're glad to be in partnership with them and getting the word out that that new product is available locally, as well as many other sources that you'll find on that website on centraloregonsos.com. So sponsors for these webinars, to bring you this information, we'd like to thank our sponsors, Pacific Power and Bend Broadband. They've been terrific in helping us do this and bring it to you every week since the COVID started. So be sure to check your follow-up email from this seminar webinar. Bend Broadband is again offering a chance to win $100 at a local restaurant, and you can actually go to the local restaurant. Yay! So keep your eyes out for that. And also a little housekeeping as we get started. So if you have questions as we go on, please put it in the Q&A box rather than the chat box, because the Q&A box is where I go to pick up on where the questions are as we go forward. All slides in this presentation will be provided to you in a follow-up email, along with a link to the live recording of this broadcast as well. So with that, I'm going to get us started. Our primary presenter today is Megan Norris. She is our Central Oregon Childcare Accelerator. And along with her is Karen Prow from NeighborImpact and Carolyn Eagen from the City of Bend. The three of us have been part of a larger group, a steering group, who have been working really hard for the last year or two on figuring out how to solve the economics of putting up a lot more quality childcare to serve the need that is here in our region. And since then, as I mentioned, a lot has happened to it. And they're here to provide you an overview of what those new guidelines are for providers, what you might expect as a family or a parent and an employer, and what the plans might look like moving forward and the work we're doing now in anticipation of that. So with that, I would like to turn it over to Megan Norris. Welcome.
Great, thank you, Katie. And thank you all for participating today. We really appreciate having you on, and I really want to thank the Bend Chamber staff for all their hard work in putting this together. I want to share with you a little bit about what childcare looks like today. COVID has devastated an already starved industry. Currently, about half of our childcare facilities in Central Oregon are now closed, with a handful of those permanently closed that we know of. Providers are struggling daily to stay open, and they have been accessing CARES money, which is a drop in the bucket for many. The first round of CARES money was about $8 million for Oregon, out of $38 million total for Oregon. The request for applications went out in early May, with the first of these funds to be dispersed in early June. We are eagerly awaiting the state plans to release the rest of the $30 million and have been advocating to get it to providers immediately. We're also hoping that there will be an additional federal funding available specifically for childcare in the next round of stimulus funds. We're hearing that that amount will be about $7 billion, but national advocates had originally been asking for about $50 billion. So again, it's going to be a drop in the bucket, and spread thinly in Oregon. Only providers that are open in an emergency capacity have been able to access these funds. Even then, those that are open have struggled to stay open because of low attendance. Some providers that are closed have applied for PPP and SBA loans. which are often cumbersome for providers, and any loans they are required to pay back is a challenge for them. We're hearing that these funds typically aren't the best tools for providers because oftentimes they don't have the connections with banks they need to secure the loans, and lenders might view these loans as too risky. More often than not, unemployment benefits have been the best fit for providers to date. Locally, we have seen our community come together and offer solutions to help childcare. I would now like to introduce Carolyn Eagen, the Economic Development Director for the City of Bend, to tell you a little bit more about what Bend has been doing to help childcare. Carolyn?
Thanks so much, Megan. Hi, everyone, and thank you all for taking a portion of your lunch and day to talk with us about this important topic today. So at the City of Bend, as Katy had alluded to at the beginning, we've been a partner in this effort from the beginning. One of the first actions that was really taken around childcare was by the Bend City Council in acknowledging how significant the need was. And we made a drastic reduction in some of our impact fees that we would typically charge to childcare facilities so that we could keep a number of facilities open last year, and then also start to have better conversations internally about what are some of the local costs that we impose on childcare facilities that we could peel back as we dealt with the need for just thousands more childcare slots for our economy to continue to grow. With this unexpected lockdown of the economy and massive change that we've all been kind of grappling with day to day, the City Council in Bend has not changed their priorities at all. They continue to keep childcare as one of their primary council goals. And I was really excited and proud of them to be able to show that community support very recently, where they put a $50,000 grant out to NeighborImpact, partnering with the county, another $50,000. So NeighborImpact got a $100,000 check from the City of Bend and Deschutes County to go ahead and make grants to childcare facilities right now who are operating under the emergency license. We continue to look for opportunities to do that. We're advocating also through our own channels, in addition to the channels that Megan and Katy talked about, to see what we can do to get the state CARES money allocated to childcare providers throughout Oregon, and we'll continue to do that. We'll also continue to look for ways that where our local barriers are getting in the way of childcare being successful. So it's a huge hill to climb, but we're right there. And as I said, we did a seminar a couple weeks ago with childcare providers. There are hundreds of people working behind the scenes to make sure that childcare continues to be a priority, and just know that we are not letting our foot off the accelerator, even though times are so strained right now. So Megan, thank you so much. I'll hand it back to you.
Really appreciate it. Bend has been a leader when it comes to helping solve our childcare crisis. And I would now like to invite Karen Prow to speak and say a few words. Karen is the director of NeighborImpact Childcare Services. She has been leading her team, who have been on the front lines, working with providers and getting them the resources that they so desperately need. She will tell us a little bit more about the current regulations for childcare that were recently released. And she'll talk to us about providers and some of their struggles and what NeighborImpact has been doing to help with those. Karen.
Thank you, Megan. So Childcare Resources team has been doing pretty consistent outreach with all of the childcare providers in Central Oregon. We're doing a weekly outreach call just to keep connected, find out what providers are struggling with, what their plans are for the future, and just what their daily needs are to be able to stay operational and be able to continue to serve the community. Right now, childcare is open in Oregon only if providers have applied to be an emergency childcare provider. And so we have a large number that are operating right now, and we have additional providers who are starting to look into opening up again as emergency childcare. Right now, with the requirement for stable groups of children, and that impacting the total number of children that a program can serve, we're still seeing a reduced capacity for childcare in our area. And so a typical program that would have larger groups of children in one classroom, they might serve 15 or 20 children in a classroom in a center. They're being asked to keep a stable group of no more than 12 children and have only 10 children on site in that classroom at a time. And so that really does reduce the capacity and will start to impact families as they return to work. Other new programs that are interested in being licensed, we can help them at Childcare Resources to go through some of the training and that initial setup, but new license will not be issued right now until we return to a place where those on-site visits can actually happen for new providers. For any guidance that providers or families are looking for as to what childcare looks like right now in the state of Oregon, because this is statewide and not county to county, you can look at the Early Learning Division website, and they have several documents there that outline all of the processes and procedures for providers to keep children and families safe. One of those documents is the sector-specific guidance that walks through all the rules and regulations at this time for emergency care. It talks about how the environment needs to be set up and all the different ratio pieces and staffing. And then there's a health and safety document on the Early Learning Division website as well. And that talks about exclusion of children. If a child is sick, has a fever, a cough, that is spelled out as a 10-day requirement for the child to be excluded from care. And then 72 hours symptom-free before the child returns. And then it also goes into a document around sanitation procedures to support providers in understanding what that schedule for keeping the environment clean needs to look like, how you can accommodate that need for additional sanitation during the day. And then there's a great frequently asked questions document that really helps providers to look at their specific situation. And if they don't see a response in that FAQs online, they can also submit a question to be able to find out how a certain situation applies to that guidance. And then they also have our childcare licensors out there that can be a service to them as well to talk through those issues. And just as far as what providers are experiencing right now, really it's that increased income due to the limit of the number of children that they can have on site that is really difficult. And then the need for many to have additional staff on site. And so you're seeing a decrease of income with an increase of expenses and overhead. And that ratio piece is really difficult for programs. There's some other just really basic things like CPR and first aid training. You can't go to an in-person class right now to get those needs met. And so a lot of concerns around keeping those requirements up, and the state is looking into how to accommodate that. Right now, there are rules in place to help to facilitate that, but just the further it gets down the road, the more difficult it is for providers to think that through. And then I think another difficult thing for providers is they had families they were serving prior to COVID, and now as the workforce is returning to work in Central Oregon and the number of children that a provider can care for has decreased, then there's that balance of how do you serve the families that you had in care prior, and really wanting to make sure that the needs of the children and families they care so much about are met moving forward. So I'll turn it back to you, Megan.
Thanks, Karen. I know you guys have been working so hard, NeighborImpact, and NeighborImpact's been on the phone daily with providers, oftentimes very emotional calls, trying to keep places open, trying to keep their students that have been with them, in some cases, since 6 months old. And dealing with the daily struggles has been a challenge, but it's amazing the work that you guys have been doing. So we really appreciate it. So we just heard a little bit from Carolyn about what the city has been doing and what's been going on locally. and Karen and the new regulations and what providers are experiencing. So now we would like to talk a little bit about what the future of childcare might look like in this new world. And this is a segment that I hope will lend itself well to the question and answer section at the end, and possibly even later on conversations. Feel free to email me or reach out, because I really would like to keep this dialogue in particular going. So just to say a little bit about what our Central Oregon Steering Committee has been doing, and Katy touched on it some, and Carolyn did too. And our committee, it consists of the Bend Chamber, NeighborImpact, Carolyn, Eagen with the city. We also have the Better Together and the Early Learning Hub and the Governor's Regional Solutions team, and OSU, Cascades, and COCC and Traces. So we have a great group of people, and we've really been working hard, especially in this, since the pandemic, to really help keep places open. We've been successful in securing some funds to, the ones that Carolyn was mentioning. That was all born on our steering committee call, and also other funds to really help providers specifically weather the storm and to make their programs more successful and sustainable in the long run. But it has come to our attention that sadly this won't be enough. And so we'd like to share a few concepts with you that we think might be a good solution moving forward. And would love to get your feedback on it, like I mentioned, through Q&A or offline as well. So the first concept that I'd like to share with you is called a shared services model. And bear with me here while I go to share my screen. Hold on 1 second. Desktop, yes. And share. Okay. Of course, now it's hiding all my little things that I need. Let's see, I think this is the right one. And I will expand this out. So this is a concept of a shared services model. And essentially what a shared services model does, and Karen, feel free to chime in, since this is Karen's been talking about this for a long time. And what it allows, though, is if you look at this this little graphic here, there's a network hub, shared staff, and all of these little circles around here might be some sort of provider. It could be a preschool, it could be a larger facility center, it could be an after-school program. And essentially what it offers is all of these a whole menu of options below. And it could be a holistic approach where all of this is offered in a shared services model, or a group of providers can choose to get together and maybe just do, select a la carte almost, and just do a few of these. But the idea is that really it helps, the long-term goal is that it helps, improve the high quality deliverance of the early education program, and can help businesses in a lot of ways. And it can also offer support for families. And so my main ways that it could do that is, increase the level of mentoring in the classroom, and provide for high quality teachers. Like I mentioned, offer comprehensive family services. Program administration could be more streamlined and benefit on the administrative level. Can reduce costs that might be incurred with food, supplies, insurance is a huge cost for providers, and also reduce the staff turnover by making sure that there's consistent hiring and training that can be offered. So the idea is that you can offer these these segments of it, and you could do research development, classroom supports, like mentor the teachers, administrative services. We see that oftentimes in childcare programs. People get into this line of work because they really love working with kids. And oftentimes it's the business part that they weren't really budgeting time for, and that ends up taking a lot of their times, and in turn their programs will suffer, and they'll start seeing a declining enrollment. And so the administrative piece, just taking on the payroll, fee collection, taxes, can really offer so much time to allow directors and teachers to focus on their curriculum. The comprehensive services, I think especially during COVID-19 is going to be so crucial right now, with mental health issues, not only on possibly the staff side of just, maybe that a family member that was sick, maybe they are concerned that they might get sick once the kids come back in. Maybe they might have kids that have experienced trauma while they've, been at home. So offering all those services and training for people, I think is going to be really crucial. It offers fundraising, development, staff recruitment, and screening, and bulk purchase of good and services. That might be food, supplies are going to be a huge thing during COVID. Hand sanitizer, cleaners, sanitation wipes, and then human services, the health and retirement benefits and unemployment insurance. So this is a model and a concept that we're really interested in. We can see this as being a huge resource to providers moving forward and really help keep costs low and efficient. It's just one tool that we could use in the toolbox, and it's something that that we're really looking at as a committee, and want to get feedback from the community on too. So I will move on to our next slide, and similar to this is a go to the second page here. It's a Microcenter model, which I think will be really of interest to a lot of the employers that are on our phone. And let me see if I can get it all squeezed in here. Can't go much bigger than that. The employers that are on our phone, and the parents too. And similar to this, there's a hub in the middle, if you will. But in the Microcenter model, this could actually go into a lot of different segments of our community. It could, we're seeing some cases where, public schools in Tennessee, for example, new public schools are having rooms where essentially childcare is offered on site for ages 0 to 5. So, this main system would be, this hub would be responsible for hiring and training the workers that would be dispersed out to these different areas throughout the community, whether it's a charter school or in a private school, or maybe it's a room in a community center or a hospital, or in an office building, which I think is a really interesting idea for our employers. And the idea is that they do the training. Again, there could be a model where it's there's food that is delivered and to all these different locations, janitorial services for cleaning up the rooms at the end of the day. And there is a director off site that is managing all of this, and keeping tabs on making sure that all these different microcenters are full and operational. So this is something that I think would be really interesting for our community moving forward, and for parents too, who, might just want their kids, on site and close to them. So I think it's a really interesting concept and model. And I don't know if you have anything to add, Karen, to any of this. Are you on mute?
Just to add that by providing the services for the Microcenter hub piece of it, that is kind of like a back office setup, it really does free up the time of the early educators to focus on the needs of the children. And so they do, like you said, get to focus on what they got into the profession for in the first place. And their attention is not being pulled away by the things that they're really not interested in. And so, they can have a successful business and really be able to cater to the needs of children and families. And then some of the bigger issues that childcare programs run into, as far as hiring substitutes and having people that really specialize in different areas, like the mental health piece, and curriculum development, things like that can be shared amongst all of those programs that are participating as microcenters. So it's a really smart way to use resources to their full extent.
Thanks, Karen. Let me see now. I'm going to go back over to, let's see, I want to get back over there. Hold on a second. Okay, so the next thing I would like to introduce, and we're really excited about this. It's been a work in progress, and a lot of time and attention has gone into this, but this is our steering committee's Central Oregon Childcare.com website. And we really hope that this will serve as a resource for our community and really offer a platform for providers and employers to come together and innovate and help solve our childcare crisis. I'll just briefly, I encourage you, in the sake of time, to visit this on your own, but we offer, you can see it. This is COVID resources. It's actually links back to Central Oregon SOS, which we've really taken the time to make sure that there's a comprehensive list of resources for folks in the community, what they can do, to see the most current regs, or if you're a parent looking for childcare. I will plug that, and I believe this is still the case, Karen, that 211 is still the best place to get the most up-to-date information via the Early Learning Division on childcare spots and availability and what's open, what's closed. But we also go down and you'll see our goals and just some useful statistics, our mission, and you can also learn a little bit more about everyone that's come together in our community to make this possible, and really in the region, all the regional chambers and our partner organizations that sit on our steering committee. And whole list of resources, again, COVID resources and guidelines. And then we, NeighborImpact did a great job, staff, putting this together, a series of fact sheets that go by cities in our region. I have a little caveat that a lot of these numbers were done pre-COVID, and so a lot of these numbers have sadly been blown out of the water. So we are in the process of evaluating numbers, but we are waiting for things to get more stable until we can accurately really track what's going on out there. But there's a whole list of resources connected to the Early Learning Division, lots of reports, and the Student Success Act, and with Baby School, our Baby Promise and Preschool Promise. And I'll just quickly go to our news. And you'll see a bunch of articles on related to COVID, and a lot of just informational articles about what the group's been doing, and the state of childcare crisis in our region. And you'll also see a page where I encourage you all to go to, get involved, and allows you to sign up. And this will come directly to me, so I can see this. And it allows you to select, for how you want to get involved. Would you like to help with COVID? Are you an employer interested in starting childcare? Are you a provider interested in starting a program? So really a list and a range of options there, and would love to connect with you and discuss it further. And I really thank you all for your time, and I look forward to the Q&A section. Back to you, Katie.
Great.
I'm gonna stop sharing the screen too.
Okay.
Yeah.
Thanks so much for the information. So we've got a couple of questions. Karen, I think the first one is for you. Will the children be required to wear masks while in childcare?
No, children will not be required to wear masks. The mask requirement is only there for the teachers, but it's optional. And there's a recommendation in there for anyone who's doing cleaning to be wearing a mask and to be wearing gloves. And for any floater staff who are going from room to room and actually giving breaks, lunch breaks, and just breaks during the day, to be able to have a mask on.
Okay. I'm going to ask a follow-up question because this, I think, is really important and if you're a provider, you already know this, but there are lots of folks, there's a couple of folks running for elected office that are on the call, and people who are elected, and some employers as well. I'd really like you just to take a couple minutes and explain what some of the key requirements are going to be that are most impactful to providers in how they operate. Can you do that for me? Because I think everybody should have some sense of the Herculean change that has to happen from the provider's end before they can reopen.
I think the biggest barrier that we are hearing is the limited number of children. And it's really the stable group of children. So for a center that may have had 16, 20 children in a classroom, and now that classroom can only have a maximum of 10 children in it, that's a huge difference. And the other thing is those, if they were able to have, 15 to 20 children in a classroom, that's at one time. And that's not the total number of children. So they may have children with varied schedules who come and go during the day. And so they might be serving, 30 children with a classroom and or more. And so that just displaces the children previously being served. It really shakes up those dynamics of friendships in that classroom and adds some instability for children as they return to care. And so there's just the logistics of the classroom and how that's being run. There are options to be able to put up barriers in a classroom to be able to create additional rooms for stable groups, but it's not the way that classrooms were run before. And a majority of centers were really designed with that number of children in mind that they would be serving per classroom. And so that makes it really difficult to stop and go a different direction with the way you had your program laid out. So I think that's the biggest one.
Okay, thank you for that. And it is significant because we also know that the margins for operating childcare centers are very, very slim. And I've had several questions in the queue regarding the Boost Up Bend funds. I want to correct what I said earlier. They are actually closed. The applications are closed. It closed on Tuesday, but that was just to put it on hold until we did a little bit more fundraising. So as more funds come in, keep watch at the bendchamber.org website, and we may reopen it again. I do know that childcare folks have applied. And so I know a lot of you are looking for what the options are to reopen, to stay open. And I know that they're pretty slim. Megan, there's a follow-up question here about the city of Bend, Deschutes County. Carolyn Eagen had to leave us. She had another meeting to get to. So perhaps you can go over how that funding from the city of Bend and Deschutes County will be distributed and what that looks like, how you apply, who qualifies.
Yes, and I'll let Karen also talk a little bit because I'm not quite sure where they are exactly on the timing, but I know that it will be in a grant form, and I believe the range is from 3,000 to 6,000. Karen, you can chime in here. It depends on, I think, the size of the facility. From what I understand, if there are additional funds left over, that those would in turn go to closed facilities. I will say that, I mean, this is, a lot of this money, and rightfully so, is going to emergency childcare that is serving in a capacity to essential workers. It's really important, since a lot of them are running at low numbers, to help keep those open for our essential workers. But the closed childcare centers are also really struggling, and they're not seeing hardly any funds at all. So Karen, do you want to talk a little bit more about the timing for that fund, and a little bit more about the particulars? You know that best.
Sure, I can do that. We are working yesterday and today to get those applications out to programs. We're doing individual calls to programs who do qualify for the money. We have about 37 programs who are putting in application for the money. They are all open as emergency childcare. And because we only have so much money, we were really targeting programs who are participating in SPARK, which is Oregon's Quality Rating and Improvement System. And so we're putting that money towards programs who are very invested in the process of pursuing quality. It is really difficult because we have so many high quality programs who are not currently participating in Spark. So that is in no way to say that those programs are not high quality. We just had to come up with a way to be able to distribute the funds, knowing that we would have limited money. And so we really hope to have checks out to people by next week so that they can get that money into their accounts and get their bills paid, with the ultimate goal of providing some stability.
And so I had a follow-up question, Karen. Somebody who's in La Pine, obviously that's Deschutes County, so you would qualify living in La Pine. Outside of Deschutes, you'd have to find other funding, or until we include other partners in the other counties around the region. Is that correct?
Yes, that's correct.
Great. Okay. So Representative Helt wants to know, Megan, if you could elaborate a little bit on the difference between a shared service model versus a co-op.
Yeah, I'll hand this over to Karen since she knows. I think that there's a lot of similarities, but I will let Karen answer that particular question.
So the biggest difference between shared services and a co-op is that shared services takes into mind the education piece of it. And so there are some things that are really specific to the needs of early care and education that have to do with the licensing requirements. And it gets a little bit technical, but the idea of the shared services is really to cater to the complexity of the requirements of state issues, local issues, to be able to support providers. And it can be around things like the requirements for staffing and things like background checks and things with teachers that need to travel with them, where it's just set up a little bit different. And there's a lot of room for partnering with existing local agencies to really avoid duplication of services.
Great, thank you for that. This is probably for you too, Karen. Someone is asking, we all know the cloth coverings, face coverings are mostly to protect others rather than you. It's to prevent your droplets, for lack of a better way to say it, to get out. But it doesn't necessarily filter stuff coming in like an N95 mask will do. So there's a question of whether or not teachers and providers will have access or be equipped with or required to have N95 masks.
So I don't want to pretend that I know more than I do. And I know that the Oregon Health Authority is really providing the majority of the guidance on this. I haven't read anything that would require that specific PPE.
Okay. Follow up from Sherry, Karen. Are there tax benefits to using co-op structures in Oregon? Do you know?
I don't know.
I don't know the answer to that either. Otherwise I would. So there are a lot of conversations that are happening at the state level. I serve on the Early Learning Council. I was appointed by the governor last year, and childcare is one of the things that we are looking hard at, as well as many other things with children under grade school ages. Just taking that hat off, because I cannot represent that board on my own. That's not my job. My job is the Bend Chamber CEO. I can tell you that it's my personal feeling, having been neck deep in childcare for the past 2.5, 3 years, that it is a time of reckoning of how we finance childcare. It is not durable. It can't survive in the ups and downs. It is absolutely vital to our economy for women, men, and families to have access to the marketplace and to the workforce. It's a critical function of our society. And my hope as the chamber CEO is to bring that perspective to the state level, that it's an opportunity to really rethink how we're doing this and how to create opportunities for people to actually be able to make a living providing childcare, and how parents and employers can have a reliable way of finding quality places where they can put their children, their employees' children, feel good about it, and also function as a workforce and as an economic society. So the need is great. We did get $38 million from the feds. About 8 million has been dispensed. I understand another 12 to 16 is coming out soon to statewide childcare providers. But the fact of the matter is the hole that is out there, and what I want to acknowledge with the providers that are on this call today is it is clear that that hole is too big to fill. And there are some people that are really suffering out there. And we need to figure out how to fix this for good. And I think that public-private partnerships, some of the concepts that we've been talking about today are the way to go. And now is the time to have that conversation. And this chamber will be pushing very hard on the state level to figure out how we can use this time to work on that problem for the long term. Couple of last questions. We don't have anything in the queue, but I really want to ask advice. And Megan and or Karen, I don't know who answers this, but if you were a parent, what advice would you be giving a parent who has a young child? You've been off on stay home, stay safe. You're re-entering the workforce. You're unclear at the fate of where your childcare used to be. What's your advice for them? Jump in there.
I'll start, Karen. I mean, I think, the first stop for me would, obviously, if they're in childcare, check with their providers, see if they're still open. Like I mentioned, that 211 number is really critical because that will give you the most up-to-date information on spots that are available in your area. I would also just make sure that you're reading the regulations, that what your childcare provider is doing, make sure that they're doing it, because it's really clear. I mean, these regulations exist because they're responsible. They have to report, they have to keep track. It needs to be official that they're cleaning twice a day, and just for your child's safety and your family's safety. And I'll let Karen answer the rest, but I think the ratios are hard to swallow right now for providers, but safety has to take precedence here. And so, like Katy said, I think it's just really important that we're in a crazy state right now. And if we were crazy before, we were in a desert. We, the childcare industry just was, dealt a difficult blow. And anything that we can do to come together as a community to help support providers right now, and long-term solutions to really tackling childcare for good is really important. But Karen, I'll let you answer a little bit more as a parent. What would you do? I mean, one thing too that I might do is, if you're required to go into the office, start talking to your employer about how they're going to handle childcare. Are they interested in doing a microcenter model? Are they interested in pooling resources to provide more spots? What does that look like? I think as a parent of a 9 and a 5-year-old, it's really important for me to have my children close, and to, in particular during this time, have them really close to me. I think that's a big comfort. So, Karen.
So I think that I maybe have a bias because I was a childcare provider for so many years, but I think that if you have an existing relationship with a provider and you plan to take your children back to that provider, having that ongoing dialogue, make sure that you ask questions and, ask for clarification on things, but then also, keep in mind that a lot of providers are going to have a hard time bringing their employees back to work. Many employees are making more on unemployment right now than they are if they return to work. And so, there's a lot of struggles going on there. And so lending some support, even just a listening ear to the provider, and making sure that you are part of a team there to provide some support, I think is really important. I know that providers are looking forward to getting families back in care and providing the support that direction, but just to walk into it with an understanding that this is very stressful for everyone, and to be prepared for that.
So a reminder in the chat box, the fabulous Madeline Rice, who works for the Ben Chamber, reminds us all that if you're a parent and you're trying to figure out where the childcare spots are actually available in your area, you can dial 211. That's the state's number that will help you locate openings close to you or where you work. And Talina also added links to early learning division, resources for providers, for those of you who haven't tuned into that, and the OHA guidance for childcare providers. We also have a link shared there for you. So I think it's good advice, Karen, for parents to stay in touch with their current providers to ensure you know the status of what your provider is dealing with, how many kids they can take back, are they able to reopen, and that sort of thing. Also, my final question for the panel is, what would you tell employers about what role they might play in helping us resolve this issue moving forward and getting their people back to work? What kind of opportunities are there out there for employers to participate in a solution? Megan, why don't you start? Because I know you've been working hard on that.
Yeah, so, part of why I was originally hired was to work with employers, and a lot of employers generously gave to my position to start solving the childcare crisis in our region. And some innovative things that we were looking at were, starting potential pilots with OSU Cascades and the NCOCC, and actually starting a childcare facility that benefited from the curriculum ideas of the early learning departments at both COCC and OSU. But in an interesting way that those spots would not only serve the faculty and students at those schools, but also employers. And so, some things that we've been talking about are employers helping with building costs or startup costs for facilities that would secure a number of spots for their employees. And those are ongoing conversations that we are having. Those are obviously building facilities lends itself to a certain number of years out. And so in the meantime, I think that there are other innovative solutions that can be addressed. And that's why we brought up that Microcenter model discussion, because I do think that that's an interesting way that employers could get more involved and actually offer childcare on site via a room, or rent a room in a space. It can look a lot of different ways, and I think that the interesting thing about that model is that it could be really flexible. But also, as an employer, I would really be talking with your employees. What are their needs right now? Have they lost their spot in their childcare facility? What are their ongoing concerns? Are they comfortable coming back to work? I think that having that conversation with employees and really gauging where folks are at is crucial to determine how you move forward and what sort of resources you might be able to offer.
Great.
Karen, I don't know if you have anything to add.
Just that the Microcenter model idea, that was something that when we started talking about it a few years ago, businesses were booming and they were really concerned about giving away space. And so we kind of have an ideal opportunity right now to rethink that and look at our priorities and look at how do you want to be involved in the success of your business 2-3 years from now, when families are looking to relocate here, they're looking for childcare, they can't find childcare because I'm an optimist and I think we'll get back there. And so what do you do now to invest in that?
Great comments. Well, it looks like we have dealt with all the questions at this point. I want to thank all of our panelists, Megan and Karen and Carolyn, wherever she is right now, for sharing an update on the picture. We understand it's not a happy picture right now. But I think that the more of us who can raise the alert on the need to find better solutions and the need to get more funding to help lift up and support our childcare providers so they can survive, the better that we are together doing that, the better we'll all come out of this situation and have at least some of these slots to go back to. There are relationships out there between families and the providers that are very, very difficult to break up. With the emergency service providers, meeting slots that may have been available to others. It's created some interesting jostling of where children are going for daycare. So there's just a lot of moving pieces out there. And amongst all the noise of all the industry sectors that are hard hit, the childcare one is one of the worst, I think, the hardest hit, and will take some really creative ingenuity to bring back in a different way. So consider this the beginning of the conversation, and Megan and Karen and many, many others will be working on this in the interim. Before I let you all folks go, let's see, final things for today is we want to remind you that we will send you all the slides that Megan shared with you today, and the resources, et cetera, that we were providing throughout this broadcast will be included in the link that we'll send you. Next week, our COVID impact webinar is going to focus on real estate. The impacts of COVID on the real estate market are just now starting to really come into stark contrast with what we've been living with over the last few years. We're going to have several experts on to walk you through what that looks like as from the realtor standpoint, the home buyer standpoint, developers, all of the impacts 360 degrees around what's going on with the real estate industry. We want to thank you again for joining us today, and feel free to follow up with any questions, and we'll try to field those for you as best we can. Thank you, everyone.